Okay. I think what I'd like to do now is to summarize or to bring together a little bit of our thinking and what we've been observing by working both from the drug as well as the diagnostic angle. And you heard from Sarah as well as Lieven that already from a diagnostic perspective, there's really a lot of pending questions associated to access of those upcoming innovation. And I can share also that from the pediatric praziquantel perspective, similar elements are there. And it comes to the point where we really need to start thinking about creating an access path for those innovations. So, but first, and I believe most of you are familiar with the 4A frameworks. What are the key elements that are framing an access path? As Sarah was alluding, as well as Lieven, there's some elements about affordability, etc. But in a much more structured manner, if we look at this framework, it starts with availability. Availability means that there is the right manufacturing and manufacturer interested in producing that particular product, associated with the right forecasting, with together a supplying and ordering mechanism. This is associated with affordability. Affordability, as Lieven was clearly showing, it has to be thought through as early as research to make sure that at the end we have a product when it's launched that is at an extremely affordable cost. But it's not just about that affordability. Affordability is also the mechanism of procurement allowing to buy from the manufacturers and to allow the countries to have access to these innovations at prices that are quote unquote affordable. And affordability is also about looking at the landscape of donors, insurance, out-of-pocket payments from patients, and seeing how this can be organized. Then from an acceptability perspective, this is the third element. Acceptability at the level of health authorities, but also at the level of regulatory bodies in a local level and regional level. And that was also one element that was alluded by Sarah, talking about the fragmentation and the way to strengthen those frameworks that are needed. The regulatory bodies there, but it's acceptability also at the level of patient and the medical bodies. Then the appropriate use, this is really how this is going to be implemented locally, how is it going to be used in terms of not only for the drugs dosage and management of side effects, but the proper implementation and maintenance. But this overall framework, this architecture, which is almost the 5th A of the framework, comes hand in hand with, in the background, the incentives, the financial mechanisms that is maintaining that framework working together. So there is the need to have really that financing aspect behind it. When we look now at, based on our experience with now drugs and diagnostics, those upcoming schistosomiasis medical products, and we look at this framework, we see that actually there are some elements where there's some gaps. It needs to be reinforced, the acceptability. We talked about touching upon the regulatory framework that would need to be strengthened, in particular for diagnostics, or at least better understood. There's some artificial intelligence also here from a regulatory perspective. How are we going to tackle this? But there are some elements that are already existing from acceptability, appropriate use, that need to be adapted for the innovations that are coming. And this is actually some of the work that, again, we are doing with the pediatric praziquantel formulation access path and the ADOPT program. But beyond those two pillars, if we look at the overarching framework of access, well, we do see that there are some very critical gaps in the availability. We see that the manufacturers are reluctant to walk into this game, to produce those type of innovations. In particular, we are thinking about in the frame of moving slightly away from a drug perspective, from donation to more sustainable access. Similarly, for diagnostic, it has to be a sustainability element into it. So manufacturers are at the beginning of the story. And today there's very limited interest from manufacturers because from a market perspective, there's really an affordability push towards low cost, and therefore there's limited incentives for them to get into that game. So manufacturing is an issue. Forecasting is today not existing, really. It has to be built, it has to be created, as well as the supplying and ordering aspect. When it comes to affordability, as I was saying, it's beyond the work that is done within the R&D space. It's really about, do we have today, for schistosomiasis innovation product, a procurement mechanism that is going to ensure that countries are going to have access to those medical products? No, there's no such a thing as a global fund for NTDs, a global fund for schisto innovations that we're preparing. So here there's a major gap, a major element on which we need to work. Similarly, the other element that is sorely missing, it's the financing backup of all this framework. Today it's very fragmented. The funds that are available are either dedicated for R&D per se or for implementation and some aspect of implementation locally. But in between, there is really a lack of financing mechanisms and funds to maintain that framework working together. So this is really something that we have to create, we have to coordinate. And today, we are already exploring some of those elements, in particular in the context of the pediatric praziquantel, but also in the context of the rapid diagnostic test we are working with FindWell. And in terms of availability, for example, for us, one element and one way of creating incentives for manufacturers to be part of this story is to foster local manufacturing capacity through technology transfer into some of our African partner countries. The forecasting and ordering, this is about engaging dialogue as early as now with relevant international and governmental organizations to create this future demand, but even just the mechanism of having forecast. The affordability, and again here it's a key element of how do we create a procurement mechanism. Today, all these activities of affordability financing mechanisms are really at the level still of advocacy, discussing with stakeholders, investing into also creating an investment case to ensure that when we go and talk with those stakeholders, we do show the benefits and the potential impact of those innovations in the context, of course, of schistosomiasis. And with this, I just wanted to end with the last slide, which is really here a call for action to the community here. When we look at drugs and diagnostics together for one given and neglected tropical disease, and this is the case for schisto for us, what we see is that there are very general, similar issues associated with the various elements of the access framework. And in fact, the issues are leading to very similar also potential options and solutions. When it comes to availability, there's a clear need to look at incentivizing manufacturers to ensure that they generate the right capacities for both drugs and diagnostics. So here there's a need to think as a holistic approach rather than one product versus another one. Again, aligning the forecast for the NTD products and here for the schisto product would be a way of also leveraging resources. When it comes to affordability, there are talks about looking at pooled procurement mechanism, but also creating more global NTD funding platforms in such a way that we are addressing more than one element at a time and a much more holistic approach for the countries. Similarly, for acceptability, appropriate use, they are very similar type of solutions. And when it comes to, and Cameron, you alluded to it with the PRV, when it comes to incentives, there's indeed PRVs for incentives of R&D, but today there's really no incentives for access per se. And here we strongly believe that it's time now for this community to really think about a global access framework for NTD products at large, if we are serious about reaching elimination of a number of them by 2030. So with this, I just thank you for your attention.